I want good science, and Big Pharma is only too happy to give us bad science, because the way the FDA is set up and what the requirements are, I mean, these are geek topics, and the normal person wouldn't really know how to evaluate it, but you only require a certain number of randomized trials. You don't have to have the proper control groups. You can have the blind to be penetrated. People can know that they're on the medications, which we know there's a big placebo effect inside medications. So the science is often inadequate. The best science is out there, then that's fine. Let's go there. And there's decent science. Let's take something like antidepressant medications. There's decent science saying it has an effect, but it's shockingly small after you control for penetration of the blind, people knowing that they're getting the active pills versus sugar pills. If you use an active control, it's probably only a few points, like in depression, on a 56-point scale, the estimate is it probably accounts for about 2 points difference. But it's a multi-billion-dollar industry. And by the way, has huge side effects. And some of these medications, 40% of the people taking them have significant sexual side effects, for example, and that's just one. The level, a single antidepressant medication can be worth $1 billion to a company. So I want good science, and I want it to be realistically marketed. I think all these commercials that we have, we're only 2 countries on the planet that allow pharmaceutical companies to market directly to people in New Zealand and the United States. It's a bad idea, in my opinion. I think that it ought to be better regulated. And when it's presented to people, it ought to be presented in a way that's realistic. For example, often people will prescribe these medications and will say, you have a brain disease, you'll have to be on these medications permanently, it's because you have a brain disease. Well, brain disease, there would be a specific biological marker for the so-called disease. There is no biological marker for depression. It's not true that we know that it's a brain disease. Is the brain involved in depression? Yes, the brain is involved with what you and I are doing right now. If neither one of us had a brain, we wouldn't be having a conversation. But that doesn't mean it's a brain disease. And so the prescribers very often oversell, and the detail people are only too happy to tell them to do that, this idea that there's something wrong with your brain, and because of that you're permanently, by the way, almost never are these medications evaluated with what will happen if you're on them for 3, 4, 5, 10, 15 years. Sometimes some of the side effects that come up only later, and sometimes they're very severe, even irreversible side effects. So I would like it to be more like, yes, these medications might be helpful to a degree, but what they do in areas like depression or antipsychotics is they give you a little more distance between the things that cause you to get entangled with thoughts and feelings. And so they might be of some help. Now, open up a little window. Now, can we go in there and learn some of these methods directly to do that? For example, antidepressant medications, you still have some depressive thoughts. Antipsychotic medications, you still have some psychotic symptoms for the vast majority of the people taking them. But it gives them a little separation, and it doesn't control his behavior as much when you have a sad feeling, difficult thought, an odd perceptual experience. We can teach people those exact skills in therapy. And so the evidence is pretty good. If you use it as just a window to get in there and teach these skills, you get longer-term benefits and without the side effects. So don't be sold just because a commercial interest wants to sell you things. The government ought to help out, because average citizen can't go out and be doing reviews of the scientific literature, and focus on the processes that have low side effects and good long-term outcomes. Right now you're going to find those in the psychosocial area and the therapy area, in the empirically supported treatments, such as ACT or cognitive behavior therapy, and go there first rather than going to the pill bottle as if it's going to be the end of your journey. It's going to solve the problem. Very often it's only going to help, and even only to a minor degree, and more is going to be needed. Well, the advice I'd give, and if you were my patient, it'd be a little different because we'd have a little more time, but if I can distill it down to the essence of what we do in a course of therapy. The person with panic, I can say this from the inside out since you're looking at a panic disordered person in recovery, has adopted a posture